Good afternoon. My name is Mohammed Ahmadi. Providing our clients with informed consent document at the beginning of our counseling sessions is one of the most important part of counseling and is mandated by all states' counseling boards. American Counseling Association says that informed consent clients have their freedom to choose whether to enter into or remain in a counseling relationship and need adequate information about the counseling process and the counselor. Counselors have an obligation to review in writing and verbally with clients the rights and responsibilities of both counselors and clients. Informed consent is an ongoing part of the counseling process, and counselors appropriately document discussions of informed consents throughout the counseling relationship. This is what American Counseling Association has mandated for all of us counselors. In Connecticut, what I have found is that a patient's right to informed consent. In Connecticut, a physician must provide the patient with the information which a reasonable patient would have found important for deciding whether to embark on a certain course of treatment. So it's that knowledge that allows the client to make that choice. And it's important that knowledge would be spelled and explained to the client. To that end, the law requires a physician to disclose the nature of the procedure, the risk and hazards of the procedure, the alternative to the procedure, and the anticipated benefits of the procedure. The patient's right to this information comes from a patient's fundamental right to self-determination. It is essential, crucial for the client to know exactly what their rights are and then make a educated decision based on that. And all these four elements cover that: the nature of the procedure, the risk and hazard of the procedure, the alternative to the procedures, and the anticipated benefits of the procedure. Informed consent is not there to scare patients. Instead, it is to provide patients for receiving treatment that go against their personal level of risk tolerance. Informed consent also protects the doctor. By retrieving informed consent, the doctor can now proceed without worry that a patient will sue later for a known and unaccepted complication. So in a way, first of all, it informs and protects the client, and of course, it protects the doctor also against any future legal actions. So it's good for both parties. It's a knowledge that they both gain from it, and they make the right decisions based on that. Usually, for every intake that we get at our counseling service, we take the client to the conference room. We have a 5-page informed consent form that we put in front of the client and explain every part of it. I also explain to them about my education, what I'm doing there. And by the time we go through the form and it's signed and everything, the client completely knows what his or her rights is. So when they accept it, that's an educated decision that they make on their parts. And that's exactly what the state and what the American Counseling Association wants. Thank you very much.